So hello, thank you for taking the time to connect with us today. I'm very grateful for the gift of time, and it's one of the things that we recognize in our work at WisdomWay Institute and as healthcare providers is this gift of presence is something that is really valuable. We know that we don't have a lot of time. We know that we're often feeling very rushed in our lives. And so taking time to challenge yourself perhaps, to learn something new, to get to know some new ways perhaps of relating to your experience and to the experience of others is something that is really valuable. And so thank you for coming today. I will introduce myself. I'm Karen Lang. I'm the founder of WisdomWay Institute and also the founder of Birthways, which is a perinatal resource in Chicago that's been around since 1997. And so I've spent a lot of my career training and mentoring people in mindful caregiving, and have also gone on to become a mindfulness-based stress reduction teacher. And WisdomWay Institute is founded on principles of mindful caregiving. Our mission is to find ways to take care of ourselves and each other better, and the benefits of the programs that we have are designed to both be enriching to those of us that provide care, to address the underlying challenges and the need for resiliency that we have as we take care of others. And it's also designed to help us be more skillful and compassionate in our care of others. So we like to think that we're benefiting both. And in relationship-centered care, which is the foundation of our programs, we recognize that healthcare can transform if we bring this emphasis of relationship-centered care to the fore. But it does require full participation of both the patient or the client and the practitioner. And that's the intersection that WisdomWay is focusing on. So that's a little bit of our background and intention and aim. And as we get settled and situated, we're challenging ourselves today to look at the reasons why someone might have actually a difficult experience with our caregiving, which is not an easy thing to do. I think that particularly those of us that have habits and conditioning around being useful and being of benefit and taking good care of people and being good mothers and sisters and friends or partners, that when we miss the mark, it's very painful. And yet I've just finished reading a wonderful book that came out of midwifery community out of the UK that talks about a compilation of different authors speaking about the challenges of truly bringing compassion into healthcare. And I think it's only by saying we could do better that we really hit the mark of creating compassionate care and systems. So anyway, with that in mind, I would like us to start with connecting with the essence of our caring, because all of you are people who have chosen in probably more ways than you even know to be generous and to be caring and to be present and to hold space for others. In some way, this drive to be there for one another is a part of your nature, a part of who you are. So as we start today, I would like for us to take a few moments to think about what that felt sense of caring feels like. So just if you could bear with me here, and if it feels safe for you to participate, taking some time to close your eyes and to settle in, and to think about a time in your life when you were facing a difficulty. And it might be a time when you faced a health crisis. It might be a time when you experienced a tremendous loss. It might be when you became a parent. Whatever, it might be when you had the flu last. I mean, you know, all of these things are part of our human vulnerability. And I would like for you to think about who was there for you. And if you're thinking about a time when you felt that you were not supported the way that you need, just sort of hold that for a moment as well. And maybe if you've got some paper nearby, jot down some of the experiences that come to mind. But while we take this full circle, do try to bring your attention as well to a time, and maybe a different time, when someone was truly there for you. And as we call to mind this time, thinking about what your body feels like. If you can imagine, you know, sitting in the presence of someone who's caring, concerned. What did it feel like when they walked in the room, or they extended themselves to you in a caring way? Think about what this person might have said or done that felt particularly on the mark, particularly nurturing and supportive. And if you had words for how you felt, what might they be? I just want us to park this experience for a moment, and we'll come back to this. But as we start our time together, I want us to root this in a sense of caring connection that we cultivate and that we need, all of us, each of us. So what led me to create this particular webinar and to have this particular conversation was encountering some of the backlash around breastfeeding. And this webinar is not, I realize that I'm speaking predominantly perhaps to an audience of maternal child providers, to those who support parents and new families, and perhaps to those who work around lactation, because that's a lot of where this dialogue came about. And some of you I met recently at a conference, and so perhaps, you know, we're emerging from that conversation and that dialogue. But I was thinking about what's happened where we've had this huge initiative designed to improve maternity care and to make facilities baby friendly, so that we are not hindering, not creating obstacles to the optimal feeding of babies and to the unfolding of the breastfeeding relationship, that we're not standing in the way of parents successfully nursing their babies. And this, in my career, has been this big goal. Let's move to this improvement in maternity care. And yet, while we've experienced this in backlash, and just briefly, you know, without you know, totally removing our good feeling here. I want to point out that what we see in these quotes from blogs that have targeted the lactation community as being blaming and shaming are words that really speak to pain, guilt, shame, blame. Many years ago, Sheila Kitzinger wrote a book about the experiences of women giving birth, and she similarly looked at the language that people use to describe their birth experiences and compared them to the language that abuse survivors, sexual violence survivors were using to describe their experiences. And that was an important seminal work that helped us realize exactly how traumatizing birth can be if we are caring for women in the ways in which traditional maternity care systems tended to care for women. So I found it really interesting and challenging, deeply challenging to see some of these same words being used for those, towards those whose mission was to improve maternity care. And it talks about all of these words: blame, shame, so forth, hypocrisy. This is Angela Andrews in Moms Rising, and she's making an important point too. And I didn't want to include this in Backlash because I don't think her point is to negate the movement to make breastfeeding accessible, especially to women of color. But she does say, I wish people didn't care about whether I was breastfeeding. They should care more about why so many minority children are on free and reduced lunch programs or suffer from hunger in our community. I wish they didn't care so much about comparing milestones or birth plans. They should care more about why Black women are 4 times more likely to experience a pregnancy-related death than white women due to unconscious bias in the healthcare system. So we also are having a call to action that says we need to hold complexity. And I think that this is another thing that's arising from, a concern about bodily autonomy. Unfortunately, I think we're creating some strange allies in this discussion about breastfeeding promotion. So with all of those challenges in mind, this sort of felt sense of blame, shame, judgment, on one hand, I think that we might want to just dismiss it and recognize it perhaps as fairly so as part of a systemic way to undermine the efforts to improve maternity care and to improve access to lactation across communities. And I think that's right. But I think that if we are to have a skillful approach as activists as well, the same foundation that I believe is important to providing good, unbiased, trauma-informed, sensitive, compassionate care, the same lessons are needed to be advocates, because it has to do with understanding the mind and the brain and how we process emotions and how we respond in the face of stress or challenge. Because I think that what's happening is that we do have movements that are designed to make us afraid and to capitalize on our stress. And I think that our counterbalance to that can be to understand that well enough that we come at things with this deep kindness and compassion. That is the flip side to a mind in stress and trauma and fear, is to create something that we call safety. And I think that that safety is something that truly, when we sit down and we do this work, because I've done this work with people through WisdomWay Institute, we realize that we don't really know what that means. We have to ourselves experience it if we're going to hope to create it. So in this next hour, we're going to have conversations about those who are receiving our care, We're going to turn attention to the provider experience. Those of us who are offering care, what is it like for us to be in healthcare systems? And we're going to look at what is possible within a new paradigm. So a lot of the work that we do at WisdomWay is helping to see the experience of health and wellness from a whole view. And that whole view is more than just a holistic view of mind, body, spirit, or even that aspect of our whole lives. But we take that broader, and we recognize that the foundations of health have to do with equitable conditions in our communities, with safety, with the environment in which we are raising our children, right? For instance, if we're talking about the care of new families. So, so we focus a lot on understanding the mind as it is meant to thrive, and also the mind as it experiences stress and trauma and diminished resiliency. And when we look at turning attention to parenting in any of our courses, one of the first things we do is we unpack this thing called parenting, which is filled with these assumptions, these cultural, individual family systems, our cultural systems, our religious institutions, all of these things inform what parenting even is. And it's embedded with gender norms and a framework that we tend to, because it's so a part of our lives, we tend to not see our own filter. We tend to not see our own bias about what we even mean about parenting. So I just pulled some slides from a workshop that we do where we talk about, are there universal themes of parenting, right? And you know, we can argue that fatherhood is a universal theme because we are so enculturated to have this nuclear family paradigm that that even those who are non-binary are working with this cultural overlay of what motherhood and fatherhood are about, even as we come up with names for what we might want our children to call us. This duality is permeated throughout our culture. And so, yes, I put this in quotes as a universal theme because sometimes the absence of, as a lesbian woman who had my daughter through a donor, the absence of a father has been a theme in our lives. And, you know, of course, I've more than reconciled that within my own family network and structure, but it is interesting that still impacts me. My daughter still gets asked about her father, and she has her own language for describing what that means for her. Universal themes of belonging, I do think, is a part of parenting, and this universal theme of vulnerability. So we look at these universal themes, and we also look at how we can break this down and really dig deep so that we're not working from assumptions about others when we start to look at how complexly constructed our identity or our thoughts about parenthood or family are. And again, this is something we won't have time for today, but I just want to identify that we can't even begin this discussion without saying we need a lot of self-work and a lot of self-awareness to even get at understanding what we mean by a shared parent experience if parents are the ones that we're caring for. So, so as practitioners, we need to unpack that and recognize that what is most important to you, what are some of your biggest concerns, what does that mean for you? These are the foundations for really getting to know what our clients need. And I do feel like even though this conversation focuses on maternal child health, these themes are universal for healthcare providers to question what they bring to the relationship when they sit down in front of someone needing their care. The other thing that we focus on quite a bit at WisdomWay Institute is an understanding of the mind and stress and how that impacts health and well-being. And this is a definition of stress from the Stress Institute, and it's something that's novel, something new you've not experienced before, unpredictable, something you had no way of knowing it would occur. Threat to the ego, your competence as a person is called into question, and you have little to no sense of control. And I think this so aptly describes parenthood that we have to assume that this definition of a stress experience is something that is universal for new parents. The other thing that I want to point out about the brain of a new parent is that we're very wired for vigilance, and whether it's, you know, the discussion of mommy brain from Catherine Ellison many years ago, or Moberg talking about oxytocin, we recognize that there are some changes, some hormonal changes in the brain of a gestational parent that leads to an increased vigilance. And this is actually true for non-biological parents as well. They too go through some brain changes that turn us into sort of give us superpowers, and at the same time can represent some vulnerabilities. I think that if we're going to understand the experience of the patient or the client, we need to understand responsive and reactive mind states. And this work arises from Rick Hanson's work. In the green zone, we're safe, satisfied, and content. This is a salutogenic state, and we have a call for healthcare to be in a salutogenic condition, right? That it's a prime place for healing. And yet, we often, as healthcare providers, which we'll get to later, experience our healthcare systems, even from those of us who have authority and power within them, to be unsafe, dissatisfied, disconnected. We feel depleted. We have a lot of pathogenic conditions happening. So we understand this responsive and reactive mind state. And if we're talking about this backlash to that's happening within the community around lactation, I think it's very interesting because we have long learned, you know, Suzanne Colson talked about hormonal profile, and years before that I always incorporated that into our training. How do we recognize the state of receptivity and readiness to feed? We need to read these states if we're lactation consultants, for instance. We need to read them in a baby. A baby needs to be in this green zone state, and the parent who's nursing. So another inspiration for an important concept that permeates a lot of our programming has to do with Stephen Porges' polyvagal theory work, that when we start to look at what it takes for the limbic system to be calm enough to feel safe and to feel supported and to learn and to make change, which we're going to talk about later, we need to feel this sense of safety. And when we don't feel safe, when the limbic system is activated, look what comes up. We see things through a black and white filter. It's either or. It's this side or that side. It's the pro-breastfeeding or, you know, that is best stuff. We're seeing things through this filter of these not actual dualities, right? I mean, we know that, of course, we feed babies. It doesn't mean that if you choose breastfeeding, you're destined to let your baby starve if you don't make enough milk. I mean, this complexity is something that's easily resolved, but yet the backlash is targeting this black and white thinking because they're cultivating a culture of fear and stress and anxiety. And so when we don't feel safe, we also either feel blame. This person caused my problem, or we feel shame. And the brain also is designed to be comparing. And that comparing means both what kind of parent am I? Do I fall into this category or that category? Because another stress response is to fight, to flight, to fight, to flee, to freeze, to get immobilized, or to follow. And this anxiety about belonging comes up for parents, as we talked about. It's one of those universal themes. So I think that we're primed for backlash. Of course we're primed for backlash. We're primed for a fear-based response to good people trying to improve maternity care systems. So, so the challenge that I gave for those of you who saw our flyer or our discussion on Facebook is, why are our clients feeling blame, shame, judgment, even though it's not what we intend to bring? And one of those explanations is simply the brain of the person that we're caring for. They're wired with that vigilance. They're panicking because they've been told to panic. They've been fed a dose of fear, and they're very anxious about where they should belong. And so I think the issues are much more complex. We can cut through that same transection that we looked at earlier of individual, family, culture, institutions, the environment in which we live, and we could have a different story for why a different woman, this woman feels unsafe and threatened for all of these reasons. This woman feels unsafe and threatened for all of these reasons. And we'll touch on that. It's such a deep topic, and I think it's best explored when we have an opportunity to really have full conversation and not just me sharing my thoughts. It's about dialogue and conversation. But let's just suffice it to say that there's this green zone where we feel it's salutogenic, we're restorative, and this red zone. And I put these images side by side because I think the red zone parent also sees the green zone parent and feels even worse about not belonging to that ideal of happy parenthood. We also know that what causes stress as people encounter healthcare systems have to do with attitudes and expectations and trauma around healthcare. In the National Transgender Discrimination Survey, 19% of respondents said they were refused healthcare because of their gender identity, and 50% needed to educate their healthcare providers. And that is never fun if you're in a stressful situation. I remember many times when I was going through a miscarriage needing to explain myself to a healthcare provider, and that was really a moment that I still carry with me some, probably 18 years later. And that 28% have postponed medical care. Another thing that Trevor McDonald talked about in this particular article was that negative experience was enough to keep someone from participating in healthcare, going back to that practitioner. A disrespect of their gender identity and a lack of acknowledgement was more traumatic than a practitioner might realize. We also recognize that when people encounter healthcare systems, there is a systemic trauma that we are needing to recognize is there for many of us for different reasons. And I also do a lot of work with patients and patient advocacy, and I'm a member of the Society for Participatory Medicine. And this challenge is how can we recognize the healthcare consumer? How do we approach healthcare, and how do we get what we need? And so I have an exercise that digs at healthcare personality. Some people feel very safe when they're in the presence of a doctor. Maybe their parent was a physician. And so that means safe, comfort, skillful, they're at ease. Well, that's not the case for many people. We may feel defensive. We may have had negative experiences. We may feel deep distrust. We may feel and know from direct experience that healthcare providers can be disrespectful of our needs and our wishes and our autonomy. And so we go into the next healthcare experience with that kind of baggage. We recognize that the complexity of what fits in front of us when we're working within a healthcare system is vast. And again, it's more than we can go into in this particular hour that we're going to spend together. But here is Stephen Porges' challenge. As responsible humans, sensitive parents, good friends, mentors, and clinicians, we need to listen to our own body's responses and respect the response of others as we help ourselves and others navigate in an inherently dangerous world to find safe environments and trusting relationships. And a lot of what Stephen Porges is a lot of who he is speaking to are therapists and mental health clinicians, but most definitely not exclusively. And if you look at the work of Sandra Bloom, who talked about creating sanctuary, and in order to provide trauma-informed care, we need to do all this self-work ourselves. This is a recurring theme, and this is such an important one, and I don't think that any of us should turn away from what is underlying this challenge. We have to change and transform our own way of relating to our own experience if we're going to be of benefit to others. And again, I think that's why I wanted to create the work that we're doing here at WisdomWay. We know relationship-centered care and trauma-informed care and working with our bias, all of these things are critically important if we're going to bring kindness and compassion to healthcare. But what we are missing is the how, the operational. How do we practice this? How do we shift? And how do we sustain it? So let's talk about what gets in the way of this relationship of salutogenic care, of a caring, calm, safe person who's not activated in their limbic system, being available to create a healing, generative space for someone who needs that, who is coming for healing or support or to be served in some way. So we need to look not only at the goodness of our intentions, that we want to create this culture of health and well-being, but we also need to recognize that that it's generated from connection with our own experience. And this is the complexity of bringing mindful awareness to our practice. Healthcare providers have for some years now, thanks to the wonderful work of folks like Satya Santorelli and John Kabat-Zinn, have been bringing mindfulness to medicine, and doctors and practitioners are taking MBSR courses, and that's great. But I feel that what we can do is do more. We can take this further. We can certainly create that foundation of working with our personal experience through taking some of these foundational mindfulness practice courses. But from there, we can also do some pretty deep work when we bring it into our lives and off the cushion and increase the continuity that we experience when you start a mindfulness practice. So in order to get to know the mind of those of us that are practitioners, we have to recognize that we're vulnerable. We're vulnerable to burnout. 10 to 70% of nurses and 30 to 50% of doctors and nurse practitioners are experiencing burnout. And I think that what we need to also look at, because my work happens to relate to also family caregivers, and I speak in all this research around family caregiving stress. And what I know is that family caregivers are often healthcare providers. They're the nurses and the carers in the family that get assigned family caregiving roles. And so we have that going on in our lives too. We also have the stress of work and family. A lot of younger lactation consultants. It was wonderful to see that our community is expanding. Years ago, I would notice that our population of lactation consultants, for instance, was a generation of folks and providers that were getting older, and now I see younger people coming into the profession and more diverse people, which is wonderful. That was one of my, I remember, aha moments at a conference one year. It's like, huh, I'm so uncomfortable to be in this place where there was not a voice for the complexity and the diversity of all of who we are, that I felt I either need to leave this profession or change it. And so I've found ways to continue to stay a part of it, and I'm thrilled to see that the face of our profession is changing. I didn't mention that at the beginning, but I'm also a board-certified lactation consultant and was trained as a midwife and perinatal educator and all those things too. But in addition to what we're experiencing in the workplace and the pressure of systems that don't work and constant change and all those things that create challenges for healthcare providers, we also have this work family. So if we've got younger practitioners joining, they're also, maybe some of you are also managing young children and finding that balance. We also have all the things that happen in our lives, divorce and loss and illness, and we also have systemic things that we're working with as advocates and as practitioners. And those systemic systems are causing us stress and trauma ourselves, often on a daily basis. We have habits and conditioning around caregiving. And I also think when I've gone back to look at the core counseling skills that I was given when I entered this profession, a lot of the core counseling skills were sort of reinforcing some of this cultural conditioning around female roles and what is natural for the female sex to be participating in caregiving, and what does it mean to be a natural parent and all of those things. So certainly we can recognize that we are influenced by this one way or another. If we've broken free of it, if we're still reinforcing it within our own habits and ways of being, it's still there. And likewise, just another reminder. I love this chart. It's available through Generation 5, which is an organization that is designed to truly conquer childhood sexual abuse and looking at issues of justice and safety. And so do check them out. We go through this in a much deeper way in our programs, but I'm just giving you a little highlight here of some of the things that we think about. In systems and collaboration, so we are a part of systems. Even if you're in private practice, you're still a part of some system, you're interfacing with other systems. And one of the things that we actually talk about in our training as well is family systems theory, where there's a victim, there's a perpetrator, and there's a protector. And I think that sometimes in an effort to be change makers, we fall into that pattern and we reinforce it inadvertently by acting as if we're going to be a protector for someone who, for instance, might be at risk of being oppressed by the system that we're a part of or that they're a part of. And so collaboration is another art that we emphasize in our programs at WisdomWay Institute, and particularly when we do on-site programs. We know that there are obstacles to collaboration. I just recently invited a conversation at a conference about collaboration, and what happened was that people sat down and talked about how painful and how terrible their systems are. And it was an invitation to say, let's talk about the art of collaboration. But there was so much pain and suffering there that we couldn't even get to thinking about what a skillful, possible alternative might be. So Lipsky has done work around this weight of bureaucracy. He talks about the fact that we psychologically simplify people when we're oppressed by a system and we're working within a bureaucracy, we don't have time to get to know their individual stories. We start to generalize and lose sight of the humanity of the person in front of us. Our bias, our implicit bias is escalated because that bureaucratic pressure and stress is designed to allow that as a coping mechanism. If you don't care, if you ignore, then it's a way of relieving stress. The other thing is to selectively give good experiences. So when we say, oh, I really like this client, I would spend more time with them, right? What we're doing is we're relieving our stress of not being able to do broader work, right? And that's not excusing it. Please, we have again, we have many more conversations that we have in our workshops and our groups, but just to recognize with enough compassion for ourselves to just be courageous to deal with the bias that we all have, and the responsibility that we have to remove those obstacles to true compassion and the things that cultivate and reinforce our bias. So Bloom has talked about systems and collaboration. So there is so much that we can do to create saner systems, but it does require the work that we're going to take on to know ourselves and how we can be most effective. Another theme that I knew I could not fit into here was Cassandra Wheaton's work around campaign science. Those of us who are advocates and want to be change makers, we need to learn some new skills to be effective, and Cassandra Wheaton has done some great work around that. So relationship-centered care is the antidote to this stress that we've talked about, both for the person that is coming for healthcare, but also it's an antidote for our own stress and suffering. And this is more than we get from reading some articles. There's a 20-year review of all that's been written about relationship-centered care, and there are some common themes. There's clear agendas of what we need to bring our attention to, but we need the how. We need to have an environment in which we can actually practice this, because it doesn't happen magically. We know that there's so much habit and conditioning in us that it feels really unsafe to drop our armor of being the expert. We want to feel some degree of security because we have all these things that are making us feel insecure. So, relationship-centered care is a deep dive, and that's where I believe we all need to go. Each partner is these are the four principles of relationship-centered care. Each partner is a unique individual with his or her own set of experiences, values, and perspectives. Affect and emotion. So Porges was talking about that. How I feel. I cannot fake. I cannot put on my face a welcoming, warm affect if I am under stress and I'm not finding a way to work with that and not finding a way to extend self-compassion, for instance. So affect and emotion are fundamental to the developing, maintaining, and terminating of relationships. And it's interesting that this is so foundational for relationship-centered care, because it's come into the fore for a lot of couples counseling. You realize that couples can't get past this if their affect and emotion are continually feeding a stress cycle. And you think about the same thing in our systems when we want to have a conversation with leadership or we want to be change makers within an institution. We all know that person that feels so shut down, it's difficult to even talk to them, right? So how are we going to work with this? And that's where a lot of, it has to start with someone. Systemic problems are still people, creating that. So we can see what we can do to create the sort of affect and emotion that's fundamental to developing relationships. Reciprocal influence grounds all clinical relationships as partners develop each other's character. it is through genuine and authentic relationships that clinicians are capable of being renewed in their practice. And there are two sort of interpretations of these 4 tenets, and I like this one the best because it talks about the heart of medicine, right? It talks about this quality of being renewed, and I love that quote from Saki Santorelli, and I think I included it in here. That we come into this healthcare relationship as healers to be renewed ourselves. Yeah. So I'm reading this book, and I'll send you the link. I just am loving this book that I mentioned from the midwives that put a call out for kindness and compassion in maternity care. And this was a letter written by Gemma Boyd it's Roar Behind the Silence. Sorry, my mind can only handle so much. This is also an acknowledgement of our own humility and limitations. But he says, I just wanted to tell you, even on the days when you're exhausted and overwhelmed, you impress me. Even when you have had a little cry in your car and can't bear to do another 12-hour shift, I think you are magnificent. Just turning up and caring for women means you are brave and clever and kind. So, you know, this sort of captures the quality that we steep ourselves in. Our retreats, I did a retreat on discovering our loveliness that I've actually repeated because it was popular, and I think that we can't spend enough time discovering our loveliness. This is where we get to access our best selves, to do the work of looking fearlessly at what our obstacles are to being kind, compassionate, and available for full presence with our clients. So this is our little mantra at WisdomWay, that we have a lot to learn. We have deep practices that we can take on together and in community, because that is where the growth happens. We can shift. We can shift ourselves, and we can shift systems, and we can shift towards a better and kinder world. And we have to have ways of sustaining it. If we're going to have impact in the world, we have to have ways of taking care of ourselves and really getting to know how to relate to our own suffering if we're going to help people relate to theirs. Our programs are very much about mind and emotions. We do a lot of somatics in our workshops and retreats, and we do the stuff that's needed for the trauma stewardship, anti-bias work, doing collaboration and mindful leadership, and doing advocacy and change making. So it's like the how of how do we get there. Just a little bit about our model, the framework for practices, the compass of mindful caregiving. And in this, we focus on skills and knowledge. What do we need to know? And also how to hold our knowledge lightly, how to make sure that we're creating room for the wisdom and the expertise and the deep knowing of those that we care for, but also how are we making room for the knowing of others. Collaboration often has to do with this empathic distress that people don't know how to relate to it, and so they overstep, or they, not overstep, that's not the right word. It's hard to trust that your colleagues are going to take good care of the person that you're taking care of. So when we start to build a framework for understanding that we all have a shared mission, collaboration comes so much more easily. And that's just some of the things that we look at with skills and knowledge, is making room for the skills and knowledge of others. Right relationship is about how we explicitly create relationships. We don't assume what's needed. We ask. We don't assume what someone's experience is. We get to know it. We move beyond the data and the statistics, and we get to know someone's full, rich life. And from there, we figure out where we fit in their circle of support. Partnering is a maintaining of this relationship. We need to have skills of mindful listening. We need to recognize and work with our empathic distress and our own trauma. We need to learn self-regulation so that we can actually create a ground. Now, one of the things that we're going to talk about as a skill briefly is the change process. Ironically, the best way to support someone who might be ambivalent about breastfeeding might be to create some open, neutral ground so that they can determine for themselves what the right step is. And that's, and I know I'm watching time here, and we're not going to have time to talk about the change process. But that's a critical piece of what we teach as well. And just a disclaimer, that's not to say, I know the research says that the attitude and the encouragement and the belief of the provider that lactation is a good idea, you know, that breastfeeding is a positive experience, and, you know, to be encouraging is true. However, we can create obstacles, and we talk about that with our enthusiasm. And compassion, of course, is all, not only the obstacles to compassion, dealing with our overwhelm and fatigue, but also doing work of self-compassion. So all these things that we learn, we practice, we adopt. This is just an example of one of the things that's a more in-depth module in our courses, is understanding the change process. And the other answer to the question of did my client have a tough experience, or why didn't they continue with our work? We were doing this great thing. If we, and again, more than we could talk about today, but when you understand the change process, if you give the wrong inquiry at the wrong time, if you start to talk about the steps of how before someone's ready to take a step, that's where we can actually inadvertently create some resistance. And that's what people experience as judgment and overwhelm, and this is impossible, and I can't really do this. So it's just interesting that we sometimes, well, I think the more we understand the mind, the more we can skillfully work with it, right? And we learn how to deal with resources and attributes needed for resiliency and creating conditions. And our work is steeped in practicing mindful listening. And I promise you, every time somebody does a mindful listening exercise, they say, oh my gosh, I thought I was a good listener, but now, wow, and like I picked up on things that I didn't even realize I was thinking or feeling or reacting, all these responses I was having. And that also, when they've done it for years, it just gets more and more subtle. And so listening is a foundation of all the things that we do. Trauma stewardship is a part of our programs, and also, as Renee Myers talks about, we need to walk fearlessly toward our bias, and we cannot be teaching mindfulness, and we cannot be talking about change in healthcare if we are not talking about bias, and if we are not talking about all of these layers of our perceptions and our identities and the intersections of these things. So this is the sort of summation of how we move from pausing and getting to know the mind and experience of the person that we're supporting, and also what we might contribute to the circumstance that leads the relationship not coming together. Did we get stuck in fixing and helping rather than serving? And I love this quote by Rachel Remen, that fixing and helping create a distance between people, an experience of distance or difference. We cannot serve at a distance. We can only serve that to which we are profoundly connected, that which we are willing to touch. Serving requires us to know that our humanity is more powerful than our expertise. So I'm going to recognize that one of my challenges is holding that space and time. So we've gone over a little bit, but I definitely would love to see if you have any questions. We have a Q&A screen, and we also have a chat. So if you have any thoughts, reactions, inquiries, you certainly can connect with us afterwards. We're happy to have a conversation and to hear about your experiences in your healthcare settings, to hear about your experience as a change maker, to hear about your experiences with difficult you know, client relationships that didn't work out the way that you intended. You know, it's okay. One of the things that I know is that it's universal. At Birthways, the company that I founded, I was able to hear from clients how they felt about the practitioners that they met within the community. They'd call and say, I'm coming to you because I felt judged, or they'd ask the question, you know, well, what kind of, do you only support people who birth naturally? I don't think that we need to create different childbirth classes, for instance, for people who want to have this kind of experience or that kind of experience. We need to create a place where everyone feels safe to learn the information that's going to be helpful and to gain confidence regardless of what their choices are. So it's, you know, another topic altogether, but anyway, do connect with us, because there are all of those things that we learn from only by connecting and coming together in community. And we hope you'll join us for some of our programs. I'm watching here to see if we have any questions, and nothing has come up yet. The three main things that are happening right now this summer is that we have our first-year specialist program. It's a postpartum doula and first-year specialist dual certification that's grounded in our philosophy of mindful caregiving and in the compass of mindful caregiving. So it has very comprehensive skills for the practitioners who are learning, and it's a great resource if you're looking to have a very top-notch program for doulas in your community doula program, for instance. A lot of deep work, and we have more content than the other programs that are available. We also are organizing institutional programs, so if you feel like it would be beneficial for your organization to have a workshop or a more intensive program, we can design something for you. And in 2020, we're going to start offering the modules for the centered care certification, so that those who really want to walk the talk will get a chance to come into community and to do that with others and to practice. And we also have family caregiving programs that are available this summer too. So if you have no other questions, thank you for listening. As we just get started with doing these webinars regularly, this was a lot of information. We do also, you know, again, communication and dialogue is so important. I always feel like, oh, you know, talking to a screen here. But I know you're out there, and thank you for giving your time today and for your curiosity and your caring. Have a great day.